appreciate coming in today, and thank you, Morgan, for inviting me to come in. My name is Margaret Arnold, and I am a physical therapist. I did my training in Scotland, so that's where the accent is from. I grew up in Scotland, and I moved over here in 1995. So what I want to talk to you about a little bit today is how I decided to be a therapist, what being a PT is like, the kinds of things I do, what I do now, how, the different things you can do with that career, some of the things with sports injuries and the kinds of patients we treat. And I want to tie in a little bit about, I'm looking all around the walls, all your pictures and posters and models that I'm sure you spent a lot of time learning about and thinking at times, why do I need to know this stuff, right? So I'm going to talk to you about how we use all of that in what I do and what I like about being a therapist, etc. So I didn't know what I wanted to do. I was about 13, 14, thinking, I knew I loved sports, I loved exercise stuff, I wanted to do something active. I kind of liked healthcare, but I didn't want to be a nurse. I didn't know if I was smart enough to be a doctor, and then I didn't know if I wanted to be a doctor and go to school for that long. So I looked into different things, and my aunt had gone to physical therapy school in the UK, and so she had said to me, why don't you think about being a PT? And of course I had no idea what that was, so I started looking into it, and you get to work with exercise and athletes and sports, because I wanted to be a phys ed teacher as well. That was the other thing I thought I could do with sports and, be a phys ed teacher. And the more I found out about it, I thought, I could earn a little bit more money being a physical therapist. There's a lot more I could do with it. It's in healthcare versus being in schools. Did I like that? And the more I learned about it, the more I thought, that's exactly what I want to do. Mostly because it kept me in kind of active types of activities. I mean, physical therapists are pretty active. They're on their feet. They're doing a lot of stretching, moving. They work with muscles, they work with athletes, they work with patients of all ages and across the whole socioeconomic, a cross-section of society. It is really, really an interesting job because you meet so many different kinds of people. Because anybody can get sick. Anybody from, somebody who's homeless to a CEO of a multinational company and everybody in between. And you treat all kinds of different people, all kinds of different conditions. So I did my training in Scotland. It was in the UK, the system for college is very different. When you get out of school in the UK, you are considered to already have, like when you get out of high school, you're considered to already have your prereqs and your basic level of government and history and English and ELE. So you don't have to do all the prereqs when you go into college, which is really quite nice. So when I got out of school, I went right into my physical therapy program, which was like a post-grad program here. And so by the time I was 21, I had my PT degree, which was kind of nice. So that's a little bit different in the UK versus here. To become a physical therapist in this country, you do your 4-year undergrad, which might be exercise physiology or health or biomechanics. There's a lot of physics involved, so we use physics and levers, and we use a lot of chemistry and a ton of biology, obviously, in anything with healthcare. So I got out of school and I worked in Scotland for a couple of years in a general hospital there as a staff physio. In the UK they're called physiotherapists, and in Australia they're physiotherapists. Here they're physical therapists. But I treated everything. In the UK, you have to do 3 months in one area, so you work 3 months in an outpatient facility. Have any of you had physical therapy for anything? Yeah, what kind of things have you had physical therapy for?
I tore my labrum, so
okay. That probably wasn't fun physical therapy, was it? No. Shoulder rehab is typically not fun. What about you?
I have my ankle, my right ankle.
Okay, broken or torn or just
torn?
Just torn. Okay, so you probably did a ton of exercises,
yeah.
Balance work, standing on one leg, all those kind of things. And we're going to get into the specifics a little bit. Yeah.
I just recently tore my labrum and I had to start aggressive therapy for it within the next month.
Okay, yeah. It's not fun, but you know what? It does make a difference, right? And so what we do, let's kind of start there since that's relevant to you guys. for you that did tour your labour and went through therapy, what kind of stuff did you do?
I don't know, a lot of arm workouts. Like,
A lot of upper back stuff, working your shoulder blades and your upper back as well. Did they work you hard or not really?
yeah.
Yeah. And then when your labrum is torn, does anybody know what the labrum is? All right, let's talk about that. So what we learn in PT school, you learn every joint of the body, every muscle of the body. You learn how all the organs work, because we need to know when we move or do sports. Typically, who thinks about it? When you go running, do you think about what's going on inside your body? No, it just happens, doesn't it? Right? But it is absolutely amazing. The more I have learned, and I've been PT for 20 years, 21 years, and I love it every bit as much today as I did when I first graduated, because I learn every single day. There's so much to learn. So when we run, not only are our muscles working, but how do our muscles work? What causes our muscles to work? We have to have a signal from our brain, right, to even know that we even want to run. Okay? So the brain sends signals to the muscles, but then how does that happen? Does the muscle just work by itself? You've got nerves that go to the muscle from the brain, so we've got to know all the nerves. And then even if the nerve sends the impulse to the muscle, what else does the muscle need to be able to work? Right, it needs to be able to contract, exactly. And from your knowledge in biology, what else do you need for a muscle contraction? Energy, oxygen, right? How does the energy and oxygen get there? Where do we get our energy from? Right, the food that we eat. So think about all those chemical energy transfer work that you've learned. How does the body transfer food energy into chemical energy? Does anybody remember the Krebs cycle? All right, you guys remember that? I hated it. But you know what? We use it all the time. And we learn it in PT school again. And it's interesting because I'm doing some research right now with a couple of companies where we're looking at the effect of a certain activity on how patients do who are critically ill. So we're doing research on patients who are in the intensive care unit, and we're looking at different modes of physical therapy and how does that impact them in terms of how much quickly they get better. And do you know what I'm going over? The Krebs cycle. So we're looking at what kind of food are they getting fed in the ICU, because a lot of those patients they've got a tube into their stomach because they can't eat. A lot of them are on a ventilator, all right, so they have no way to eat. So we're looking at the nutrition that is fed through their tube, and how does that get to their muscles? Does that make a difference in how much we can do with them for physical therapy? So the Krebs cycle is pretty important. What about our heart and lungs? Do they have a role in physical therapy? Of course they do, because we need oxygen, right? The Krebs cycle needs oxygen. Cellular respiration needs oxygen, right? All of our systems need oxygen to work. How does the oxygen get to where it needs to get to? We've got to breathe it in. It's got to be transferred from the lung tissue to the blood vessels, right? So our lungs better be working right. We better be getting a good expansion of our lungs. And then the oxygen needs to transfer into the bloodstream. And then the bloodstream needs to be working pretty well to get around our body. And then the veins need to be taking all the waste products, carbon dioxide and lactic acid, those kinds of things, back out of our system, right? So we learn about all the different systems. It's not just the muscles and the bones, because we need to know if the muscles and the bones aren't working properly. If somebody can't run, or if somebody can't move their shoulder, we've got to try and figure out why not. That's the first step, is why can't you run? Or why can't you move your arm? Or why is your knee clicking every time you try and jump? Or whatever it is. So what we look at is we look at the muscles and the bones themselves, okay? And sometimes the muscles are working just fine. So we've got to look someplace else to find out why it's not working or why it's painful. Sometimes it's the nerve that's not working. So we've got to know how to test the nerves and see if that's the problem. Sometimes it's a food and an energy and a lung or heart problem. That their muscles are fine, but they've got maybe some other issue that they're not getting delivery of the right products to the muscle, or it's causing them pain. All right, so the other thing that we learn is how all the nerves work from the back. Anybody ever had lower back pain, or your moms and dads, or had back pain, and okay, personally or just family members? Personally, okay. And I see this a lot more now than I ever did in younger people. Can anybody think why a reason might be why we're seeing more and more back pain in younger and younger people?
Poor posture.
Mm-hmm. Poor posture. And we spend a lot of time doing this, right? In this kind of posture. And think about when you're texting and using your phones, you tend to be looking down. All right? So that impacts our posture significantly. So we are seeing more. The other thing we see more is we tend to be more casual in terms of how we do our homework, where we do our homework. How many of you sit in Indian style on your beds doing your homework? Or you're sitting with your feet up? Any of you do that? How many of you routinely sit at a table with good posture in your homework? We just don't anymore. So we are seeing more of that than we used to. So that's one of the things we look at as physical therapists, is not just the treatment when the problem happens, but we also look at the health and wellness and injury prevention. So we tend to be the posture police. That's what I'm called when I go into, oh, posture police is here, stand up straight, you know. Because we know it makes a difference. My poor kids I'm on them all the time about their posture. I have three boys, myself, my oldest is 15. They're out at Western, and my middle one is 13, and then I have a 6-year-old. So I'm always on those poor kids. I drive them nuts about posture. As far as treatments in the hospital, what kinds of patients do we treat? I spent most of my career treating orthopedic outpatients. So I would do a lot of knee injuries, back injuries, shoulder injuries. I treated lots and lots and lots and lots of labrum problems and rotator cuff tears. Lots and lots and lots of people with back pain and neck pain. That's a huge, huge problem. And headaches. So physical therapists do a lot of work with patients with headaches, because a lot of headaches come from the muscles in your neck. All right, a lot of tension headaches, stress headaches. Stress is a big, big problem in the working population, and we're also seeing it in school-age people as well. Do you guys ever feel like you're under stress or no?
Oh yeah.
A little bit. When you get more homework than what's reasonable, and you've got tests due, and you've got all this stuff, and you've got sports and schedules, and you're running, and you don't have time, right? That's stress. And stress manifests itself with tension in our muscles. Does anybody know what some of the classic stress signs are? You might recognize them in yourself when I tell you. One of them is clasping your hands and tension in your hands. All right. Now that's not the most classic, because we tend to be using our hands. The other one is tension in our upper neck muscles. And do any of you have problems? Do any of you find yourself rubbing your neck? All right. Take your fingers and just rub your fingers through your neck muscle. Does anybody have knots that are really sore when they cross over on their neck muscles, or it feels like you're kind of pinging over a bowstring?
Oh yeah.
Okay, and it hurts when you do that? That is tension. That is tension and stress. And the other thing, I work a lot with ergonomics, and I'll get into that. That's kind of where I've chosen to take my career, and I'll tell you about that in a minute. But I work a lot with people who work at computer screens and who are sitting like this for long periods of time, and they have the most horrendous trouble in their necks. And one of the best things to do for that is pressure. So I teach people to take a tennis ball or a golf ball and just hold pressure on those trigger points, and it works great. So that's a little trick that you guys can take from here today.